Ekirwadde ky'ekifu ku maaso kizuuliddwa mu bayizi mu masomero nga bangi tebasobola kusoma nnyukuta zibali wala oba okumpi. Dr. Kasadakawo Moses omukugu mu by'amaaso ku ddwaliro ekkulu e Mulago agamba nti abaana bangi tebalaba balina ekifo ku maaso.
The studies that have been done among school going children indicate that 11.6% of them have actually refractive errors. And with the rapid assessment of avoidable blindness that have been done in the two regions of southwestern Uganda and northern Uganda, whose figures you can extrapolate to this place, indicate that over 60% of the population have refractive errors.
Singa ekirwadde tekikolwako mu bwangu kiviirako amaaso okuzibira ddala ne batakola bulungi mu bibiina.
If you're not careful with those children, then they can easily lose interest and hence drop out of school. The other form they usually have is short-sightedness, myopia. That one, if not corrected, makes it difficult for them to copy notes from the blackboard and to see what the teacher is teaching. Therefore, if not attended to, can also lead to drop out of school.
Herbert Kato akulira abalambula amasomero e Kasese agamba abaana okuva ku kibiina ekyokuna okutuuka ku kyomusanvu balina ekizibu kino.
And they are more serious when they are in secondary. But in primary, if not detected early, they can proceed to secondary when they are being treated as normal diseases and cause more harm to the eyes. And this began as eyes paining, eye straining, and sometimes young ones see just clouds as they read.
Dr. Viola Arunga yawalirizibwa okusaawa eddwaliro okuyamba ku bantu ku maaso agamba bangi bazuula ekizibu ku maaso ng'obudde bugenze.
But that is a key misconception of thinking that eye diseases are for the old. No. From a newborn who can be born with an eye issue, it goes on through primary school. We have seen that it's responsible for a number of dropouts and poor performance in schools.
As we are working through the local government, we are using the community health workers that are going to be conducting the door-to-door. In other words, we are building the village health teams or community health workers in capacities of conducting eye screenings. That is one. And the other is that we would want to reach out to as many people as possible.
Munnabyanjigiriza Kata agamba abamu ku bazadde bagana okutwala abaana okujjanjabibwa olw'ebyobuwangwa byabwe.
And village schools, they assume as if it is a cultural problem where parents say they are bewitching my child, they are not wishing him or her good.
Byatumusime Gerard, Salty TV, Nnyo.